What's up, Health Occupations kids? I wanted to give you guys a little insight on what Chapter 2 is all about and what you should be working on today. So Chapter 2 is all about, or part of Chapter 2 rather, the first part is all about healthcare facilities and all the different places you can work as a healthcare worker depending on what profession that you choose. The second part of Chapter 2 is more about health insurance plans and deductibles and co-insurances and all that fun stuff we'll talk about later. What I want you to work on today, though, you got your notes. They're fill in the blank just like last chapter. It's a little different this chapter. They're going to be for a grade. They all have to be filled in on Friday. So on Friday, you have to have all your notes filled in. And you're going to turn them in. I recommend following the agenda that I'm going to post, and you do a section of notes at a time. So today I want you to work on, if you look, the chapter's divided into sections, and so are your notes. I want you to work on Unit 2.1. So this is the first part of Chapter 2. Like I said, it's all about healthcare facilities. So for me, for example, I'm a respiratory therapist. I am a teacher, but I used to be a respiratory therapist, and I still keep my license up. So when I first started investigating and looking around and decided to be a respiratory therapist, I looked at all the different places I could work. As a respiratory therapist, I can work in the hospital. Now there's different parts of the hospital I can work in. I can work on the floor, I can work in the ER, I can work in the cardiac heart floor as well, the ICU, the NICU with the little bitty babies. So as a respiratory therapist, one of the facilities I could work in is the hospital. Another place I could work is home health care, which is when you go out to patients' homes and set them up on oxygen and that sort of thing. I could also work in the sleep lab and do sleep studies. That's the area that I was interested in. So the latter part of my career I spent working in the sleep lab because I really enjoyed doing that and watching people sleep and diagnosing them with sleep apnea and setting them up with their CPAP machines. So that's for me. A lot of students in the class tell me that they want to be a nurse. Nursing is so huge. There's so many different facilities you can work in. You can work in the hospital. You can also work in home health care. You can work in the clinic and do a typical 9-to-5 type of thing. You can work even in a jail, believe it or not. One of the guest speakers came a couple of years ago and they were like, really, you have to have nurses in jail? And that's what that particular nurse explained. Yes, there's doctors, nurses, healthcare workers that even work in the jail system. You could work as helping out with genetic counselors, which we're going to talk about this chapter. You could also be a hospice nurse, which is also in this chapter. Hospice nurse isn't, I would say I shouldn't say a sad job, but it is. But somebody has to do that, and people are interested in that. So there's many different things you could do with nursing. Maybe you want to be an x-ray tech and take x-rays. A bunch of different places you can work there. You can work in the hospital. You can work in a clinic. You can work in a doctor's office and that sort of stuff. This chapter, they also talk about laboratories if you want to be a phlebotomist and work in the lab. And things like that. So this first part of the chapter is all about healthcare facilities. So as you're going through the notes are kind of like, not going to give you a specific vocabulary list this chapter, but each different facility is like a vocabulary word. So genetic health care center or genetic counseling center, hospice, home health, hospitals, laboratories, clinics, all those are going to be kind of like your vocabulary words, and you need to put little stars by them and focus on them. So I just kind of wanted to give you a heads up with what was going on with this chapter. As you can see, I posted a question up there. I want to know, based off of that question, what do you want to be in healthcare? Why are you taking health occupations? Are you interested in the medical field? So what do you want to be? And what type of facility do you think that you want to work in? Let me know on the question, and I hope to see you guys soon. Bye.